Conspiracy theorists, or conspiracy factualists, as I like to call them, seeing as most of their predictions have an uncanny habit of coming true, have a phrase about how the regime are going to go about the slow business of holding their hands up to the catastrophic failed public health experiment of the last 3 years. They call it a limited hangout. CIA spy jargon for when the veil of secrecy is shredded, the government is caught with its pants down and the phony cover story can no longer be relied upon to misinform the public. Governments resort to admitting, sometimes even volunteering, some of the truth while still managing to withhold key and damaging facts, hoping that the public is so intrigued by this new information that they fail to pursue the old matter to its conclusion. Now, the sceptical side of the COVID argument seems to be split fairly evenly between two groups. The cock-ups, who maintain that the whole sorry affair was a giant cock-up from the start, believing that these pesky politicians with their tiny IQs would struggle to organise the opening of an envelope, and the conspiracy theorists, who believe that the whole sorry affair is the machination of globalist elites who have alleged to have cooked up COVID in a Chinese lab to necessitate a vaccine which could then be used in turn to bring in vaccine passports, swiftly followed by digital IDs, thus ending freedom as we know it and turning us all into battery-farmed useless eaters, grateful for our free plate of gruel 3 times a day, never to see a Mediterranean sunset ever again, or indeed ever. I was interested, therefore, to read the report published today by Perseus, compiled by a multidisciplinary team of experts from various fields, including medicine, safety management and pharmaceutical regulation. It doesn't really matter which camp, cock-up or conspiracy theory one falls into. This is titled Safe and Effective? The report has in its sights the much-maligned MHRA, tasked with ensuring the safety and efficacy of medications used in the UK. The report is brutal, and if indeed it is, as many will suspect, part of a limited hangout, it certainly lets a lot hang out, going further than before in shredding the veil of secrecy and highlighting the reckless idiocy of our besieged health regulator. It concludes that the MHRA has failed in its duty to protect the public from harm. It states that the MHRA did not require the mRNA alchemists to demonstrate their concoction's long-term safety. It failed to act promptly on widespread reports of adverse reactions to these so-called vaccines, having labelled the mRNA gene therapies vaccines in order to fulfil lower regulatory requirements in the first place. It failed to address the problems with manufacturing, quality and control, leading to the now famous batch quality problems that so many of the vaccine injured associate with their particular post-jab suffering. And it did not act on the grave concerns raised about the quietly withdrawn Oxford AstraZeneca potion. Do you remember that one? The one which brought the vaccine passported Wimbledon tennis to its feet in worship of the vaccine's creator. A potion which has, in some cases, left in its wake blood clots, heart inflammation, neurological conditions, immune downgrading and menstrual disorders, among hundreds of other side effects. It calls, the report, for the immediate cessation of all of these so-called vaccines until a thorough, independent investigation takes place, and yet again, us conspiracy factualists are proved right for the 100th bleeping time. It will take many years for society to come to terms with the evil meted out on us as quacks or crooks, depending on which side of the cock-up conspiracy argument you fall on, fumbled in the dark for a miracle cure for the COVID cold. People are still reeling, and hindsight is not as sharp as someday it will surely become, as this limited hangout becomes rather more permanent. But I raise this as there are pressing lessons to be learned from the COVID times that can be used wisely today. The same models, the same rushed solutions which led to the COVID catastrophe are being used by the same bad actors and the same fearmongers to push another hoax, the so-called climate emergency. Fairy tale horror stories of what is to come if we don't go for net zero carbon this time instead of net zero COVID. The fearful and controlling among us, envious of our freedom and satisfaction in life, will use exactly the same strategies as they did with COVID to leech away our liberty by the climate hoax. So, as I said, it doesn't matter which side of the argument one is on. If we want any semblance of a return to a good life, it is incumbent on us to remember those disastrous times, learn from them, and swear never, ever again.